Welcome to 5-Minute Physical Therapy. My name's Ethan, and today I have 3 range of motion exercises for the knee. So I have long arc quads, a hamstring and quad stretch, and last I have like a modified squat. So to start off with long arc quads, very simple exercise, shouldn't be painful at all, but basically you're just gonna kick out, you can hold for a little bit and come back down. So the key things for this exercise is don't use momentum. Don't just swing your leg. You want to have control, ascent and descent. So up and down. And what's nice about this is you can do it at work when you're sitting at your desk or sitting in the recliner, just to kind of get your legs moving. So we'll do about 10-15 here, but really you should be able to do about 30-50 of these fairly easily. So let's do about another 5 more. And you really want to control it. That's kind of, you're going to get that muscle activation and just nice range of motion for the knee. Alright. So we'll move on to the next exercise, which is the hamstring and quad stretch. Ideally you would be on a bed or a couch, and you're going to lie on your back. And you can grab yourself a strap if you have one, or if you have a sheet, you can do that. I'll link this strap in the description below, so if you want to purchase this one. And there's a lot of other things you can do with this strap. So what you're going to do is you're going to put it on the foot, bend up the other knee, keeping this leg straight. You're just going to pull the strap, and you should feel the stretch right here in the back of the hamstring, getting that nice knee extension as well. Again, kind of relax. Don't try to lift your shoulders up in your head, just because it's going to strain your neck. So you can have a nice pillow or just lay flat and just relax the neck. Now with this one, you want to hold for about a minute. Any longer, your foot might fall asleep. So if that happens, just let it back down. But or you can do it 30 seconds twice, but try to get up to that minute. So I'll just hold for another 10-15 seconds. And what's nice about this is you can use your arms to kind of hold up the leg to get that stretch, and you can pull to get more of a stretch, or release to reduce the stretch. And you want a nice gentle stretch. Don't kind of over torque it or anything. You want to feel the stretch and then hold. Alright, so now for the quad stretch, what you're going to do is now just get close to the edge of the bed or the couch, and you're going to kind of just pull in the opposite direction. So now you're stretching the front of the leg. And we'll hold this for about 15-20 seconds. But again, try to make it up to that minute. And you want this knee up instead of down, just so you don't arch your back. So this helps kind of stabilize that pelvis region. And same thing as the hamstring stretch, very gentle stretch, don't over torque it, just a nice gentle stretch. Alright, so last exercise is going to be a modified squat or sit to stand. So you can have a chair behind you. I recommend having the chair behind you just as like a cue. And what you're going to do is basically you're going to sit down into the chair and stand up. And that's just going to help get that range of motion in the knees, but also help sort of gain up the quads and the glute muscles. So very important is you want to make sure that your knees aren't passing your toes. So when you sit, don't put the knees too forward where they're passing your toes and then sit. You want to make sure that your lower leg here is kind of straight, and then you're going to sit down pushing your bottom back. And then up and down. And you can fully sit and then stand up, or you can go, touch, and then come back up. Good. You can use your hands to kind of offset. And this is a very good exercise. I bet after 20 or 25, your legs are going to be burning. So this is very good for the knees, building up the muscle, and also getting that range of motion. Good. Let's do about 3 or 4 more. And just from that many, my legs are starting to burn a little bit. All right. So that concludes 5-minute physical therapy for the knees. Thank you again for watching. If you liked the video, please hit that thumbs up and hit that subscribe button. Thank you.